Today's class is hiring strategies within the world of healthcare in 2023. Subtopic: 5 ways to attract top talent. And I don't know if you guys know this, but it's hard to hire folks these days, especially within the world of healthcare. So really looking forward to this conversation. I'm Nick Ferrante, host and trainer here at Frasco Profiles. Frasco is a US-based full-service consumer reporting agency founded in 1995. We provide enterprise-level employment checks, drug testing, fitness for duty physical exams, Form I-9, and E-Verify services to employers worldwide. We employ SOC 2 Type 2 certified data security measures and ensure that the ultimate protection for all sensitive consumer information that comes through you will be protected by us. iCIMS is our other co-sponsor today. And now more than ever, healthcare providers must quickly cover need to fill roles, even in the most challenging of hiring environments. iCIMS is trusted by top-ranked hospitals and healthcare organizations, and their talent cloud provides a unified platform to attract, engage, hire, and advance clinical, administrative, and support staff across your entire healthcare organization while staying true to your values and community commitments. Gotta love it. Our guests today are Ed Pedini, Head of Customer Advocacy at Seekout, and Rachael Austin, Principal Account Executive at iCIMS. Let me say a little bit about Ed. As the head of customer advocacy, he has over a decade of experience in talent acquisition, leading organizations to establish and scale effective recruiting systems through optimizing recruiting teams, technologies, and processes. Ed is a self-described generalist with a passion for solving complex business and technology challenges in high-growth environments. He has been an early employee or co-founder for multiple startups with a focus on HR and recruiting technologies. Rachael Austin is, again, the account executive for the healthcare vertical at iCIMS, the talent cloud company that empowers organizations to attract, engage, hire, and advance talent. For the last 12 years, she's had the pleasure of helping healthcare leaders with their hiring and retention, workforce management strategies, as well as other things. At iCIMS, she is focused on ensuring the success of each organization's talent transformation through automation efficiencies with an end-to-end best-in-class hiring solution. Rachael lives in Phoenix, Arizona with her husband, 2 silly daughters, 5 and 2, and her snoring bulldog, who can be heard on most calls. She looks forward to talking with you and your team more in the future. We are very excited to present the team today for hiring strategies within healthcare in 2023. Welcome, Ed. Welcome, Rachael.
Thank you. Excited to be here.
Thanks. Great to be here.
We are excited that you guys are joining us. Let's start with our first question. And in the chat, you guys can ask questions, ask for clarity, anything like that, and we'll do our best to transfer that information back over to the guest today. We actually have a multi virtual setup today with Teams and Zoom. Very exciting. But question 1, what are you seeing coming out of the pandemic, and how has it affected healthcare hiring? Ed, you want to start us off?
Sure, happy to. I think throughout the pandemic and coming out, burnout has really been a significant problem right across the entire healthcare industry. We had people put under so much stress and so much work that we've seen a huge departure of talent from the industry as a whole. Nursing in particular has one of the highest permanent quit rates of any role in the country. And nursing managers have the highest permanent quit rate of any role in the country. This has left a huge gap in terms of available talent at health systems, hospices, home care, aged care, all sorts of facilities. And in turn, put incredible pressure on the healthcare professionals that are still doing their roles and doing everything they can to ensure the best possible patient outcomes. And the TA and the HR teams that are trying to make sure that new talent can come into the organization and existing talent can be developed upwards into the roles that need to be filled. Really stuck between a rock and a hard place, I think, for a lot of organizations at the moment. Has left for a very challenging time for everyone involved.
Yeah, I would definitely agree with Ed. The things that we're hearing from our customers, our healthcare customers, are we don't have enough workforce to even employ the positions that we have open. So they're having to do a lot more with a lot less. Many organizations are coming to me more focused these days on doubling down on their branding, ensuring that they're trying to lead with their mission, their culture, and be really acutely in tune with talent. And it's hard. It's asking a lot of them. It's making sure that everyone inside the organization, from HR, TA, learning and development, are all on the same path and collaborating. And I think Ed hit a really good point around internal mobility. It's really focusing your talent acquisition strategies around skill-based hiring and internal mobility. For 15, 20 years now, our most hated word is turnover. So from my lens, we've tried to change that into a much more positive aspect of how do we focus on your retention strategies. And a lot of things I've seen, I've done this for about 15 years of my career, where I've worked in workforce management, but I've also worked in recruitment. And a lot of times those two teams they don't strategize together. So they're coming to us and asking us, how can we strategize together? How can we build our plans together? And they take those plans and that consultative approach to building out their talent acquisition strategies, along with what HR, learning and development, their people organizations are doing. And it seems to be helping. But we are in a very tough position, because during the pandemic, I want to say it was estimated 1 in 5 healthcare workers decided to leave the workforce, and we're not seeing them really come back. The great reshuffle, the great resignation, reshuffle, we're on to the great reset. It was not great for healthcare. Some other industries experienced those movements much more positive than healthcare did, and healthcare is really still trying to bounce back from it.
I think that call out about branding and the renewed focus on branding is a really interesting one too, Rachel. I think many years ago, a lot of people would have considered healthcare one of those passion fields that people get into because it's something that they feel really strongly about and drawn to. And historically, that's had a sort of deflation impact on salaries. These days, with so much competition for talent, employers are finding that you really have to either get out the checkbook, or you have to find really good reasons to bring employees into your organization. The checkbook is a limited tactic that not every health system can use, especially with so many not-for-profits out there. But really being able to talk about your brand and your mission and your culture and your values, and using that as a core talent attraction strategy, that can be super effective. I mean, there are a lot of people out there who are looking for very different work environments, and every health system, every hospice, every aged care home can really think about what it is that makes them unique and what they have to offer, or what the specific team in question has to offer. And being able to get that message to the right person at the right time and get your point across can really be a significant competitive differentiator in terms of your ability to attract and hire talent without necessarily just having to pay more.
Yeah, and I completely agree. I think your comment about getting the checkbook out almost weaves into what we're going to be talking about later on, about the biggest challenges in healthcare hiring. You're exactly right. Like, most of us got into healthcare because we were passionate about it. And I come from more of a sales perspective. I could never be on the floor, bedside, working in a hospital, but I enjoy the industry. I enjoy how complex it is, how unique it can be. I couldn't be bedside, but I found my path into it because I was passionate about healthcare. So I think you're exactly right. We just have to really get the message right in the very beginning. And it's not a one-size-fits-all approach anymore.
So you guys both mentioned getting out the checkbook, and you both talked a little bit about the passion play as far as why people got into the industry in the first place. And this is kind of a very popular topic out there on the interwebs and on job boards and other places where potential passion employees gather to talk about what are they going to do next. And I've seen a lot of chatter out there about how they're not so interested in passion anymore because they feel like passion kind of got burnt out a little bit during the pandemic. totally understandable, easy to see how they ended up with that. And do you think that there's not as much opportunity to rely on maybe passion moving forward to pull people into the healthcare market? Or you do think, tell me more about that checkbook.
I would agree. I don't think passion is going to attract people anymore. I think you have to reach out to them differently. A lot of what I've seen in the last 7 years in healthcare is, and this is really more from the inside and how they're structuring their recruiters. They started not just having recruiters, but they started having sourcers. And those sourcers were dedicated to going out and finding the best talent. But like Ed was saying, you've got to really know who you're working with. So who the candidate is and what's important to them. Because benefit packages aren't that super flashy anymore. We've heard certain generations they don't even really contribute to their 401k. So the things that I was used to when I was applying for jobs and looking for who was the next best employer, those were like typical things you highlighted. Those aren't that important anymore. People are looking for pet insurance. Like, Petey's back here, my bulldog. But like, I would love to have pet insurance. He's 10 years old, and so there's just things now that people are attracted to, and they might seem silly, but it's things that we could invest into our talent and into our workforce that might be that important to them. And I think the recruiters now really have to get to know the candidates and who they're working with to better understand. And back to your question about getting the checkbook out, inflation has happened. There's a lot of uncertainty in our economy. There's inflation that has happened. We have unlimited PTO might not cut it anymore. We might just need to be making more money so that we can feed ourselves, our family, our lifestyles. So you've got to come in with competitive wages.
I want to ask the folks in the chat, what are you guys seeing coming out of the pandemic? Have you guys added additional wages? Have you added additional benefits? And if there are special benefits, maybe write those in the chat for us so we can kind of see what it is that you guys are trying out. And maybe we can discuss whether or not it's working. And Ed, I want to jump back over to you because you brought up the passion thing, and I think this gets taken advantage of in a lot of places. I know that it happens in childcare, whether it's education and teachers getting a little taken advantage of salary wise, or maybe a lot taken advantage of salary wise when you do the math, or even early childhood daycare. Those people often get taken advantage of because of their passion. We got a couple of things popping in here: retention and loyalty programs. Incorporated the hybrid work schedule. All right, so that's a lot of that's the things we kind of expect to see. Where do you think this conversation goes forward when it comes to passion, Ed?
I think that there are examples of industries that take advantage of that, and perhaps at one time there was some of that at healthcare. The thing is, it only really happens when you have an employer's market instead of an employee's market. Yeah. When there's more talent than there are roles, then it is relatively simple to have that deflation effect on salary. When there are more roles than there are employees, then passion becomes table stakes. And it simply isn't enough anymore in order to be able to attract and hire the people that you ultimately need. As a TA team, as a recruiter, one of the most important questions you can ask yourself is, what's in it for the candidate? And being able to answer that uniquely for the different kinds of audiences that you're trying to attract is critical to being able to bring people into the organization. And there are so many answers to that question. If you have the checkbook, that is a perfectly reasonable answer. If we can pay you more than somebody else can pay you, that's what's in it for you, and that may be how I can bring you into my role. But that isn't all that people want. People want work-life balance. People want rewarding careers that have an impact on the people that they work with. People want a sense of community, to feel that they're heard and that their participation matters and that they can be active in the groups of people that they work with. People want to work in places that have missions and culture and values that align to their own worldviews. And something that we see very much in nursing in particular is people want things like flexible schedules that allow them to fit the rest of their lives into their work. And I think as an individual health system or hiring organization, you really have to be able to identify what it is that you can provide that somebody else can't, and ensure that you're able to get that message across and use it as your primary hook to attract that talent that you need.
I love it. I think that you're on the same page with a lot of the folks in the chat, and we're going to go to our second question. What are the biggest challenges you're seeing with within healthcare hiring? And then there's two things I want to jump back to that folks put in the chat that I think totally line up with this question. Rachael, you want to lead off on this question?
Sure. So, I mean, I hate bringing this back up, the shortfall that we have with our workforce. And I know we spend a lot of time talking about nurses, but one of the estimates that came out, it was like 13 million nurse shortage by 2030. That's huge. And years ago, another study came out. It was like 1 nurse for 3 open positions. So that's really hard. That's hard. It's extreme stress put on our hospitals, our healthcare organizations, our long-term care organizations, our home health, whatever it might be. So again, I think leaning into your internal mobility plan, and really identifying who inside your organization, inside your home, they are looking to potentially move, and giving your leaders the ability to go out there and identify who those people are and being open to moving them around to create a career path for them. I think that's really important. We right now I'm in a role where I focus a lot on recruitment. Prior to this, I was in a role that focused on performance and succession planning. There was a big gap, and I talked about this just a few minutes ago. There's a huge gap, inside your learning management software solution that has your performance plans and your competency plans. You're tracking all of this annually as a healthcare organization, but not often does that information get relayed to the talent team. So wouldn't it be nice if you had one place that your talent team and your HR team and your learning and development team could work out of to really collaborate on who those people are that can move around your organization? I think that solves one of the challenges we have. But ultimately too, as we were talking earlier, it's really about ensuring that your branding and awareness is on track. Most people are going to Google and searching reviews, and then they're leaning into their network and asking about you. So that's where it's all starting. So making sure that you have great branding, great awareness, and controlling that is going to really help.
So you've talked about a couple of things there, and I don't want them to be buzzwords. So when you're talking about branding and awareness and your online presence and reviews, you're specifically talking about the very real perspectives that people can find about your organization without necessarily talking to anybody at your organization, and probably without visiting your website.
Yeah.
How do you see that being an avenue that HR professionals can take to drive recruiting?
So it's interesting because when you go to a hospital's website or a healthcare organization's website, it's so well branded. It's branded for the patient, it's branded for the consumer. When you flip over to their career site, it often doesn't have the same look and feel. And it's because sometimes the marketing teams are working, the marketing people are more fluid and fluent in how do we brand towards patients and consumers versus how do we brand towards candidates. That's a whole different branding mechanism. And so we need to start collaborating those two and aligning them with each other. So something you'll see, you can go visit, I mean, probably a local hospital in the area. If you look at your patient side of the marketing and then you look at your candidate side of the marketing, most of the times it's drastically different. And so today, a lot of organizations I'm talking with, they're coming to me going, we know this is like starkly different. How do we make it better?
I mean, I've seen
Now,
websites where it like you got a beautiful
Yeah.
website and then you step back to 2001's internet when it comes to their
Yeah.
careers page. And I can totally, I can see it I can see it in
Yeah.
my mind what happens online.
And you know what's really cool too that we've been talking a lot about is, so right now, one of the big buzzwords in healthcare, whether you're looking on Forbes, Gartner, Deloitte, Becker's, is AI. Everybody wants AI, machine learning, and a lot of times they talk to it more towards the patient side, but they don't talk towards it on the recruitment and process management and change management side. Some hospitals that we visit with, they'll have a chatbot on their patient side about services and how can we help you? How can I schedule an appointment for you today? But then they don't have a chatbot on their recruiting side. So it's meeting the candidates where they're at too, because an overly complex hiring process is going to lead to decrease in conversion rate to apply to those jobs. So that's what I tell them all the time. You invested in a chatbot on your patient side, but you didn't invest in your recruitment side. A lot of times those are two different departments making decisions anyway, but it's such a small little thing that you can add to your career site that will make a huge difference and put you more towards that consumer-centric branding that you already have that exists, but just moving it over to the candidate spot. You brought up another good point too, of like, okay, it's not just the career side. We've got to be more out there on social media. We've got to be more out there on our reviews, Glassdoor, wherever they're coming from. That's easy. If you have a hiring suite that has social distribution automation built into it, it's going to be automatically posting your job to LinkedIn, to Google, to Indeed. Like the number one sources right now, our industry insights report is actually rolling out next week. It actually talks a lot about how do we meet our candidates where they're at. And most of them are starting their search on Google. And then 57% of nurses are actually applying on Indeed. That's a huge spend, but it's worth looking into it and diving deeper into the analytics and like where your candidates are coming from.
I love it. I think you've touched on a lot of really great points there, and meeting people where they're at is clearly, a great way to overcome a lot of the different challenges that we're facing within the healthcare hiring industry. Ed, same question to you, and there's a couple things that have come through in the chat where we've got people talking about people pushing back and negotiating on offers, pushing back on other benefits. That if you got a bad reputation as far as your patient advocacy rates and how many patients are on the floor at a single time with a single nurse or a single healthcare professional, that all of those things are very important, and candidates seem to be more aware than ever before, according to the chat. So what are you seeing?
There's so much competition that people have available in terms of the role that they can choose from that they really have the opportunity to push a lot harder and be a lot pickier about the roles that they're working on. But it's also become so much more difficult for the right person in the right role to actually find each other, to get through all the noise and find the opportunity that's actually the right fit on both sides. And a lot of this pushback, this negotiation, it's a symptom of not having actually found the right position or the right role or the right opportunity from either side in the first place. There was a time not that long ago when you could fill all of your roles through traditional recruiting methods.
Oh, yeah.
You could post your job ads, you could have your stock standard career website, which was just a list of jobs. You could go to your career fairs, you could work with your educational partners, you could run your referral programs, and you fill your roles, especially with so much of the talent coming out of local markets. That stopped being true a couple of years ago, and it's become very, very difficult to attract inbound interest and inbound talent through the traditional channels. 25 years ago, the software industry looked like this. And you could hire software engineers by posting job ads and to be successful. That market changed drastically as those salaries shot up and as competition for those roles started to increase. And recruiting teams at tech companies started to adopt really modern ways of thinking about how you find and attract talent. You look at organizations that have these modern hiring programs, and they do a lot of the things that Rachael is talking about. They're very, very focused on brand. They have a super crisp value proposition. They leverage marketing that was traditionally about attracting customers. They leverage those same tools and tricks to attract talent. And very frequently they go to where that talent is. You look at the way that an Amazon or a Meta or a Google will hire, there are armies of recruiters that go out and find people who are a good fit for the role and bring them into the recruiting process. And that's something you traditionally haven't had to do in healthcare. Now that we find these same challenges with healthcare talent, it's been a really turbulent time as TA teams try and adapt and bring those skills into the organization. They often find themselves running on legacy systems that don't have the features or functionality that they need to implement programs like this. They find themselves with limited budgets because we've spent it all on travel nurses and haven't really thought about what we need to do to attract and retain talent. And they find themselves with just a really complicated change management process when you think about all of the new skills that you need to bring to your TA organization and how you get people to the point where they need to be to do some of the things that you see other industries doing.
2023, right?
It's a very, very complicated environment. And I think we see the successful health systems making that change and adapting those same processes that we've seen other industries do over the last several years. And we're seeing it work, but it certainly isn't an easy journey. And it certainly isn't one that every organization can do overnight.
Yeah, it's not something that every organization can do. And I want to move to our third question here. And I think there's a lot of different ways we can take this particular conversation. But question 3, what separates healthcare organizations from hiring successfully from those that struggle to attract talent? And I want to ask it in a couple of different ways because I've seen some things in the chat. I want you to think about this not only in successful versus unsuccessful, but how do rural healthcare centers or rural health providers compete with maybe higher salaries, maybe better benefits, maybe safer work ratios, lower overall struggle, higher work-life balance with maybe an urban hospital with greater accessibility or density with candidates. So first, what separates healthcare organizations that are successful with hiring versus those that aren't? And second, can you speak to maybe a little bit about the dichotomy between rural and urban healthcare systems?
In terms of successful healthcare hiring, I really do think it's this continuation of the modernization of the recruiting process. There is a ton that we can learn from other industries that have faced these problems that do apply and that do work when we're trying to hire healthcare talent. I was looking at this just the other day. Last month, on Indeed in New York, were 20,000 job ads for RNs or some kind of RN that have been posted within the last month. So 20,000 open roles less than 30 days old for RNs in New York. There is just no possible way that anybody who's actively looking for an RN role could go through all of those 20,000 and find the one that's right for them. And there is no way that organizations advertising and putting the message out there are going to get that message in front of all the right people they actually need to talk to. You really have to find a way to go to where your talent population is. The branding component, the social media component, the event and in-person component, and having recruiting teams that can proactively go out and find talent and bring them into your recruiting pipeline are really critical in terms of being able to compete in such a crazy market.
I think you're right. Rachael, what do you see?
So I would say we did a study here and it was pretty outrageous. I was shocked at the results. It was like 90% of applicants who applied took the job that reached out to them first. And that's all in your communication methodology and your approach. And is that difficult? Yeah. I was on the phone with an organization yesterday that was like, oh, we make like 100 offers at one time. That's quite a bit. So being able to go through as many candidates as you might be receiving is going to be really hard. Really, I'm starting to see organizations in healthcare specifically start to consider their tech stack and looking at ways that they can enable AI and machine learning, and then add on layers of technology that might be text messaging bi-directionally, because that one-way text does not work. You've got to be able
it's
to
very
communicate
annoying.
back and forth. Right. Like, it doesn't matter. So there's so many organizations that they're like, I have text messaging, but I can just send. I can't receive anything from the candidate. Well, you're not really having a conversation then. And that's how your phone is in front of you all the time. That's how it is for most candidates. They're not sitting at their computer anymore. They're applying on their phone. So I really think it's adjusting your technology stack, really looking at it and seeing what you need, and meeting the candidates where they are. I know I keep saying that, but your candidates are on their phone. They're looking at their text messages. It's getting them to apply as fast as you can. In the hospital healthcare arena, you really have those, you've got these critical, difficult, high volume, visible positions that you've got to hire quickly. And those like RN, therapy, researchers, coders, and then you've got these business as usual positions that are equally as important. And they do turn over just as much as your nurses do, but they're really starkly different application processes. And a lot of organizations will have one application process for the same role.
Interesting. In the chat, real fast, Rachel, in the chat, I want to see amongst our participants today, do you guys have separate processes? And write separate in the chat if you have maybe a separate process for your healthcare professionals versus your health professional, or sorry, your professional folks who manage the outside needs or non-healthcare needs within your organization. And you said something else. You got to meet people where they're at, and they're on their phones. And I have to think, just based on my experience in going to the doctor's office and unfortunately having to go to the ER a couple of times, because I got a 9-year-old and a 6-year-old, so similar ages to what you're dealing with. Kids get in trouble, kids get hurt. It happens. And I have to imagine that a lot of the time that people are looking for jobs, they're maybe in between patients. There may be in let's just be real, they just got angry. And I wonder how many organizations are responding with a much more immediately gratifying responses like chatbots to connect with people in the midst of that emotional I don't want to say trauma, but in that moment you're unhappy, you're looking to go somewhere. And I think if someone responds to you in that moment, you're probably like, okay, cool, let's talk some more.
Yeah, I'll entertain it.
Yeah.
Right. You know what's crazy too? And I'm looking at it. I see it on our screen. There's a QR code right below me. QR codes were literally going to the wayside before the pandemic.
Oh yeah.
And then the pandemic happened. And if you were in a state that allowed you to go to a restaurant or maybe ordering, QR codes all of a sudden started popping up everywhere. So you know how people are applying jobs? Whether I go to the grocery store, I go get a cup of coffee, there's a little sign that says, hey, click this QR code and apply.
Yeah.
So think about it from a healthcare perspective. You go in as a patient, you're sitting in the waiting room for a really long time. Maybe you're like, wow, I'm having a really good experience here. I would like to work here. Then scan a quick QR code and start the apply process. And it would be great to weave in automation. So being able to schedule your first interview within 2 minutes on your phone, that's how you're going to really build up your funnel and start attracting those candidates and getting them in the door.
I would have to think that I would have a different job right now. And no offense to Fresco. I love my job. I love working at Fresco. It's a good company. But everybody gets mad sometimes. Everybody gets frustrated sometimes. If in that moment there was a process where within 2 or 3 minutes someone was trying to set up an interview with me, I would probably be somewhere else, because I think that that's just taking, the opportunity where it exists, where people are in a heightened emotional state, willing to make a change. And because everything fades, right? You're really frustrated. You had a nasty talk with your boss. You had a terrible interaction with maybe some of the corporate staff at the healthcare facility, and you're thinking to yourself, it's time to go. You go home, someone cooked dinner, you relax with your dog, your cat, your kids, you're watching on the TV on the couch. And by that time, if that's the initial response, 5, 6, 7, 10 hours later after you've made that initial outreach, you may be over it and you may not be willing to go through the work of transitioning. And you hit QR codes, which is, I think, a great lead in for our fourth question. What technology and digital experience are you seeing being utilized to attract applicants other than healthcare? QR codes and this is what I know we're doing. I'm making TikTok HR recruiting videos these days, because we have found that there's a huge audience of people who are looking at investigation related topics on TikTok. And if we pop up in their feed as far as an HR opportunity or a recruiting opportunity, there's a real upside for us. And so what else are you guys seeing?
I think that again, we're seeing a lot of things that have been working in other industries coming into the healthcare industry for the first time. Rachael talked about branding and the importance of a really fantastic career website, and I think that's a huge one. Being able to showcase who you are and the people that work for you, and being able to get your culture and mission and values across as part of that process is critical. And more health systems are starting to use things like rich media, videos, interviews with staff, interviews from hiring managers to really showcase who they are and what it means to work there. And similarly, making it dead easy to find and apply for roles on the website. If anybody here on this call is running a career website that requires you to make an account before you can apply for a job, there is a very significant difference between the number of applications you get if you have that kind of process versus the really simple one-click easy apply process you get from modern systems.
I even see websites occasionally where they gate the career opportunities. Not even gating the application process, they're gating what their open positions are, because they think that they need to capture that information. And sure, you do, but at the same time, I'm not going to give you my information just to see if you might have a job available that works for me.
It's very true. And we work with everything from little rural doctors' offices to massive multi-state enterprise health systems. And the one thing that we keep seeing over and over again is that you can't advertise your way out of a talent shortage. There's no amount that you can spend on job ads that's going to get you the talent that you need. So for us, a really large trend is empowering teams to be able to go out there and source and attract passive talent. How do you find people who aren't looking for work, who would be a great fit for the opportunity you have at hand? How do you get your message in front of them and provide a compelling argument as to why they should enter your recruiting process? And how do you take that person through all the steps required to actually get them hired while the iron is hot and the interest is there before they go and they take another role? It's a complicated and time-consuming thing to do. And having the right technology, the right platforms, the use of AI, of machine learning, of automation that allow these recruiting teams to do more with less, and allow them to really do that one-to-one personalization that you need to be effective at that kind of strategy, but to do it at scale, and to do it across the entire breadth of the talent that they're looking for. These things have really become game changers in the healthcare industries, and is one of the core pieces of technology, I think, that's really setting those successful organizations aside from the ones that really struggle to hire.
I mean, sifting has always been a difficult thing for HR. how do you determine which of these candidates is a good fit and then move them forward in the process? And in the early 2000s, the advent of internet-based technology allowed a lot of HR organizations to outsource that sifting. And it created initial complications where some of the sifting happened against ADA compliance and rules like that. And we've kind of moved into I think a new horizon where people don't want to be sifted by software, or at least they don't want to know they're being sifted by software. And they want that experience to feel a lot more tangible and real and interconnected. Rachael, what are you seeing in that sense?
Nick, I think you brought up a really good point about gatekeeping information. Like, we want all of your information now. Well, that feels so impersonal. Like, I'm not even sure you're going to even look at my application, but you want all of this information now. So where we've been able to come in and really create a new journey for them in their apply process is say, what's all the information you need right now to qualify someone quickly, and with software, be able to ensure that they're a good job match. There are tools out there that do that. A little thing that we always go to battle with is going with your full HCM suite that includes the applicant tracking system versus going with an organization who actually focuses 100% of their innovation in an applicant tracking system. That's the battle we go with towards every day. And I can tell you more often than not, organizations, they end up going with the HCM. They get locked into it for 3 to 5 years because it was a decision by their C-suite and IT teams. But they then in turn, in 3 years, once it's been deployed, say, wow, we can't use this because they boxed us in and they don't give us the workflows that really help us attract and hire quickly. So we need to look at something else. And they want us to help build them business cases, which we are more than happy to. But it's, how do we change your apply process where we can quickly identify good fit versus not good fit and get them to the door, and then build out another stage in the workflow of like capturing all that information once you've had a conversation with them. Because you're working with different candidates who are very skeptical of giving out their information these days. You just got to really look at your workflow today and be willing to be agile and flexible and adapt to change, because that's what candidates want today. And Nick, you brought up a second point about just innovation and technology changes. We are seeing a lot of need and desire around machine learning and AI. And I know that those conversations can be really scary because we don't know a lot about it. But from a recruiting perspective, it can really help improve the candidate experience if you're able to job match them quickly. So if they land on your career site and they upload just a little bit of information, having a system that will surface up 2-3 jobs immediately that they can apply for versus searching your career page through 15 pages, 300 jobs, even 50 jobs. Nobody wants to do that. They want to spend under a minute and a half on your career site. So you just have to be flexible and really look into what your workflow looks like today. Whiteboard it out, and you'll be like, wow, we could really make a change here. So
let me ask you guys in the chat. You guys write opportunity for me if you think this is your situation. You think there's some opportunity for you to update either the technology stack that you're using or your digital experience for potential candidates. Write up opportunity in the chat for me. I want to see how many people this is resonating with. A lot of people are responding in the chat, and I think that you guys have really hit on something here where it's not just buzzword stuff. Like if some of the subject topics that we've gone through aren't things you're familiar with as an HR professional and an HR leader, you're probably missing candidates that you could have right now. And you guys both help with these matters, right?
Yeah.
Absolutely. I think if you're in the recruiting space, you probably can't go a day without seeing an article saying that ChatGPT is going to take all our jobs away.
Yeah.
For sure.
And the reality is that's true. Like, I think until we get to the stage where people actually want to be hired by computers, I don't think anybody is too at risk of losing their job to tools like ChatGPT. But what we can do is we can empower people to be more efficient, to be faster, to have the right information, to make the right decision. And there are some really fantastic use cases for technology in that space. I think recruiting teams that are able to bring their technology into their process in the right way, where you're empowering humans to do more and not taking people out of the cycle, because ultimately everybody that you employ wants to work with people. So you want people in that decision-making process. I think those teams are going to see massive efficiency benefits from these tools. And we're only really at the tip of the iceberg in terms of what's probably going to happen over the next 5 to 10 years. Absolutely.
Technology will continue to advance, evolve, and in some ways complicate the process, but hopefully, as we all kind of hope, I think, it simplifies the process as well. I think that's a great lead into our fifth question. What healthcare worker retention tips can you guys share? What are the things that are keeping healthcare professionals at an organization?
Rachel, you're welcome to start.
Sure. I think we talked a lot about this early on. I really do think it starts internally, and it starts with getting your HR, talent acquisition, learning and development, your people up, sitting down at a round table and talking about what they do, and how they impact people. And I think you're going to get a lot out of that conversation, that round table. Every organization is a little bit unique. And who handles is there a pre-boarding process? Is there an onboarding process? What happens in each one of those processes? Oh, what does the performance process look like? When are performance evaluations done? Because your recruiters are going to want to know, is there a medical assistant that's finishing up nursing school? I would be interested to know, I don't know what studies are out there, I haven't looked in a while, but how many talent acquisition teams know that information? Right now, a lot of groups don't have the system that's collaborative enough to be able to see insight into that. But if you have people at your organization, and you're a larger organization, so even organization that's 300 people, it's gonna be hard to keep track of all your people, but you have a system in place that's keeping track of it. So being able to share data and make really meaningful decisions with that can help drive your hiring strategies as well. And asking simple questions of like, what keeps you here? Why do you stay? What would make you leave? And documenting that stuff and being able to collaboratively talk with the TA team, the HR team about what's happening, I think it's going to open up a lot more for you to do internally and really focus on that mobility inside of your four walls.
Absolutely.
And we brought up a conversation about rural areas. I mean, it's even an opportunity. We saw a lot of people moving out of cities, moving to rural areas. It's just finding ways to really engage with them. So I would say roundtable it out, figure out what all the teams are doing. Don't just rely on the TA team to come up with these strategies. I think, Ed, you might agree, a couple of years ago, TA wasn't even sitting at the table helping make decisions. And now our C-suite, the C-suites are coming to them and saying, wait, you guys have a big stake at the table. Like, we can't make revenue unless we have people. So I need this information now. And they're having challenges with that data, trying to pull that data. And you can't make decisions if you don't have it.
No, it's hard. I mean, I was historically in sales. I'm in kind of more of a marketing role now. There's always been a disconnect between marketing and sales. Like, marketing is putting out collateral that doesn't make sense for sales to deliver. Sales isn't telling marketing that is the case. And it seems to be the case with internal HR with reviews and check-ins and making sure people are healthy, whole, and happy, in comparison to talent acquisition, not sharing that kind of environmental information that is really relevant, especially when you're talking about advertising roles and getting out there and broadcasting why you're branding, why your values matter, and how you actually, live them out as an organization. I think that is an excellent topic. Ed, what do you got on this one?
I completely agree with everything Rachael has just gone over. We have this conversation quite a lot with people leaders and with workers as part of helping organizations develop and improve their retention strategies. And we hear a few common threads. Surprisingly, especially to people leaders, more pay is not at the top of the list. Not to argue that we don't want to make sure that we're paying fairly, but that doesn't tend to be the number one concern. The most common thing that I hear from healthcare workers as a whole is work flexibility and scheduling flexibility being one of the biggest drivers out of organizations. That can be a hard problem to solve. If you don't have your staffing levels where they need to be, then you might not be able to provide the flexible schedules that your workers want. If you don't have ward managers and nursing managers that understand the role and understand more than just people management and what it means to be a care provider in those environments, it's not always possible to make the right decisions, especially when you have to go slightly between the lines to get things done. And people are absolutely leaving roles for these kinds of things. The second most common I hear, I think, is the internal mobility challenge. You have to ask yourself, for every person that leaves your organization to one of your competitors or to another role, did they explore an internal opportunity with you before they took a new opportunity elsewhere? And if not, why? 9 times out of 10, the answer to that question is that it was easier to find a new role than it was to find an internal opportunity. We spend all of this time and all of this money to attracting new people, having great career websites, building compelling job descriptions, having good interview processes, and then we don't invest in doing those same things for our current employees.
Yeah.
I can't tell you the number of health systems I've seen that don't have an internal job board, or just mirror their external one and then don't have a special process for internal employees. Or people who feel that if they apply for a new role or try and move into a new department internally, they'll get retribution from their manager or from up on high. It would be easier to go elsewhere than to raise their hand and say they're thinking about looking. But if you do that, you'll bleed talent instead of promoting talent internally. It's a complicated problem to solve, but again, the technology is out there. The systems and the tools have come a long way in the last 20 years. And it is possible to give your internal employees that red carpet treatment to make it easier to find and explore a new role internally than to go look elsewhere. And if you can tackle that challenge, you can make such an enormous difference to retention.
I love it. That's a huge thing. Keep your people happy. Treat people like people, and they'll be more likely to stick around and stay, and thereby reducing your overall burden of onboarding new staff. And happy employees refer their friends to come work for organizations. So you guys have touched on so many things. We're coming to a close here. We'll have, as we promised, there is a thank you opportunity from us to you, from Seek Out to y'all, and as well as ISIMS to all the participants today. And here is the SHRM activity ID. It is 23-WHVX3. Don't forget, you will receive a thank you email tomorrow that includes the webinar recording and an opportunity for you to give feedback.